My name is Catherine Kosin. I'm the Volunteer and Membership Program Manager at Chevy Chase At Home. For those who are not familiar with us, Chevy Chase At Home is part of the nationwide village movement in which neighbors get together to help seniors in their communities age in place. We provide volunteer services to our members in the Chevy Chase area, like rides to medical appointments, changing light bulbs, friendly visits, and we also offer. Oh, sorry. One reminder: if everyone can make sure you're muted, so there's no background noise. All right. So sorry. I'll continue. So we also offer social events, clubs, and educational programs like this one to keep everyone engaged in their community. You can learn more about us and find out about our other upcoming programs that are open to the general public on ChevyChaseAtHome.org. We are so glad that you could join us for the first installment of our exciting new series, Navigating Life's Journey, in which you will learn how to navigate your options for each stage of aging. In today's session, our fantastic panel of elder care professionals will discuss how you can plan for aging in place and all the preparations to consider. I now want to introduce our co-hosts and partners in this series, Angelique Jackson and Kirsten Parsons, who will be moderating the panel and telling you about our speakers and the flow for the event. Angelique Jackson, LPN, is the Manager of Marketing and Business Development for Charles E. Smith Life Communities. Angelique has been a nurse for over 16 years, serving the areas of post-acute and hospice care. She has a passion for serving older adults and educating them about their care options. Kirsten Parsons, MS-RDN CDP, is a Director of Healthcare Sales for Ingleside. Kirsten has worked in senior living for the past 11 years, 4 years of which have been with Ingleside. Most recently, Kirsten served as the Independent Living Administrator for Ingleside at Rock Creek. Kirsten started her career in long-term care nursing, then pursued further education in human nutrition, working as a clinical dietitian for seniors at all levels of care. Kirsten is committed to excellence in senior living services and is passionate about educating and equipping older adults to lead healthy, wellness-filled lives. So without further ado, I want to hand it off to Angelique and Kirsten. Thank you.
Thank you. Thank you so much. Welcome. First of all, I want to just say welcome to Wendy and congratulations on your new role at Chevy Chase At Home. Also, Catherine, thank you so much for the warm introduction and all the time and energy that you spent creating the series. Thank you to Chevy Chase At Home for giving us this space to have such an important conversation. I also want to say thank you to Kirsten Parsons, my co-host and also my co-creator. I really couldn't have done it without all of her insightful and wonderful contributions. And then most importantly, I want to say thank you to the viewers for joining us today. We hope that you find this discussion helpful. And we also want to hear from you. So we really want to dedicate the last 30 minutes to taking questions from you and interacting with you. That's the best part of these type of conversations anyhow. And then last but not least, thank you so much for all of the panelists that are joining us today. This is a group of very knowledgeable women who bring so much value to these type of conversations. And so I just want to thank you for your time, your energy, your expertise. And I would ask that if you could please introduce yourselves with your names, your title, organization, years in service, and then just a summary of what you do. And thank you.
I'll start. Hi, everyone. I'm Alison Carelli. I'm a licensed clinical social worker. I'm an aging life care manager and a psychotherapist with Aging Network Services. We're based in Bethesda. I've been in the aging services field for 8 years. And in my current role, I help my clients navigate the challenges of aging, help to match them with the right resources, and become a stable presence in their lives. Our services are very individualized, so I have the pleasure of being flexible and doing different things for different clients and families. So thank you for having me. I'm happy to be here.
Thank you, Alice.
Hi, my name is Allyson Butler. I am the Director of Business Development for Smithlife Home Care, covering the Washington, D.C. territory. My background is 25 years in hospice. I've been in the home care side for just a little over 4 months. But in my role, I provide education to the community and to our clients on the types of services we can provide at home to help support them in their desire to age in place. Thank you.
Good afternoon. I'm Debbie Hedges, and I am a licensed clinical social worker, and I work with Jessa, and the Director of Senior Services. And in this role, I have the pleasure of working with a very talented team of social workers and care managers who support older adults in the community and their families, helping them to age in place and get connected with all of the support and resources that they need in order to do so. And I have been in the field of aging services for 26 years and have been with Jessa since last year. So thank you so much for having me, and I look forward to talking with you.
Good afternoon, everyone. My name is Kathleen McGuinness. I'm Director of Community Relations for Smithlife Home Care. I'm an end-of-life certified specialist and also a certified dementia practitioner. I work for Smithlife Home Care, and we provide certified nursing assistants to help our community age in place. I have been doing care for family members for longer than I'm willing to admit. Let's just go with a long time. And I'll pass it on for the next introduction.
Thank you, Kath.
Hi, I'm Jihan Starr with Davenport Senior Connections. I'm a solo practitioner, an elder care consultant, and have been in the industry for close to 20 years now. I have a background in assisted living, as well as hospital emergency management, hospice, skilled nursing care, and a few other things in between. Really, really enjoy working with seniors. Thank you for having me.
Thank you, Jihan.
Hi, I'm Susy Elder Murphy. I'm the owner of Debra Levy Eldercare. We're a group of aging life care managers. And just to clarify, in case people aren't familiar with that term, our association, which came into being just over 35 years ago, used to be called the National Association of Professional Geriatric Care Managers. So some care managers still use that term, geriatric care manager, but members of our association, the Aging Life Care Association, typically use aging life care manager or aging life care professional. I've been with Debra Levy Eldercare for 28 years, and our company on November 1st just celebrated its 33rd anniversary. So we're a team of 15 care managers, mostly full-time. We have registered nurses, social workers, and gerontologists on our team. And we also offer some unique programs, including the Well Senior program and our concierge companions, who are Debbie's Angels. And as care managers, we help in a variety of ways. We say we're like wedding planners for growing older.
Thank you so much for that.
Good afternoon. My name is Rebecca Bianco, and I work for Family and Nursing Care. I'm a business development manager for Family and Nursing Care, which means I'm the liaison for communities and hospitals and other organizations of folks who may, and liaison for the company and for the community. So. And what I do is I meet with folks who are looking for certified nursing assistants to help support them in the home. And so I'm excited to be here. I have to say I am the baby of the group. My years of experience are probably closer to 4 than the rest with it, but I absolutely love what I do. And thanks again for having me.
Thank you so much, Rebecca, for the introduction. And
All
so
right. We ready to jump in?
Yes, take it away.
Okay, so I am Kirsten Parsons. I am with Ingleside. I thank Catherine for hosting us, and Wendy, welcome. We are going to jump right in. Angelique and I are going to ask questions, and our panelists are going to share from their expertise. So our first question for our panelists is, when we say age in place, what is meant by that terminology? So any of our care managers who want to jump in and answer that?
I'll start. Hi, everyone. Again, it's Jihan Starr. Aging in place is a term that we use in general, but it really allows us to help a family navigate what it's like for an aging loved one to be able to stay home and receive all of the necessary services in their home. Their home may be their respective home to which they've lived in and raised their family in. Their home might be an assisted living on a campus that has various levels of care. That home might be living with a relative, and in most cases, their children. And so what is that like to age in place? And as care managers, we try and determine, does that mean that someone's going to need someone to come in and help with meals? Does that mean that maybe we will have to hire a clinician to help with medication management? We look at it holistically also. What will the families, especially those that they live with, or if their families are out of town, play a part in that aging in place? Does that mean that someone's going to have to stop working? Are they going to have to move to help with their loved one? There's so many different components that I want to allow some of my other colleagues to jump in. But aging in place is a good way of saying, we want you to stay home. We want to bring the services to you, but are you healthy enough and financially, can you afford it? And I'll let someone else jump in so I don't completely take over.
Thanks, Jahan. That was a great explanation. And often we talk to people about chapters. There may be that chapter of your life that it still makes sense to stay in that family home, but then your care needs may be such and your finances such that the next chapter might be in a different setting. As Jahan said, perhaps living with a family member or moving to a community where you can more easily get the care that you need at a financial place that is sustainable for you.
And then I'll add, aging in place really is a matter of supporting what your long-term goals are. So for somebody who feels strongly about wanting to age in place, and I know we'll talk more about this later, but starting the process early and getting to know what resources are available to you in your homes, which all of you have started to do by being members of a village, which that really is their main goal too, to help you figure out how to make things work where you are.
So I have a follow-up question to that. So when we talk about aging in place, who are the key players that should be considered when we're trying to build a plan to age in place safely at home?
I'll sort of go again. That can be from your medical team. So that consists of course, your physician or whomever the specialist you may be seeing. Sometimes they actually have house call services that could help benefit in someone aging in place. Maybe your local pharmacist is someone else that we want to consider. Is there a home care agency that we're going to have to put in place that can help with your activities of daily living, or that meal preparation, even down to like housekeeping? You know, still involving your neighbors. Could there be someone that can check on your loved one if a spouse or an adult child has to go to work? Speaking with your financial planner, as well as your elder law attorney. All of these people really play a part in you being able to age in place. And clearly something like a village, very important that a care manager would reach out to the services of a village when they have a client that's trying to age in place, because it's an added layer of support. So those are some of the key people that I think of when I think of aging in place successfully.
So much for that response. It's great. And then I do want other folks to add, but Jihan, you mentioned the elder law attorney and the financial piece. And I just want to say that too, that is a very important topic. And that is the topic of our next discussion on December the 3rd. We will be doing the financial and legal planning for your future care needs. So I just wanted to go ahead and make note of that upcoming next month. But does anybody else have anything else to add?
I was just going to add very broadly, if you step back and think about who is your current support network, and that looks different for everybody. For some people, it might be, your blood family, your children, or it could be close friends, or even I've worked with a number of seniors who it's coworkers, or more distant family members, like a close cousin. So thinking about who these people are that are closest to you, that you interact with the most, and the folks that you want to really hold on tight to and keep in your life as you do age in place, having these conversations with them about what you hope to have as your plans. So that's a really very broad way of starting.
Allyson, and you're right. Another group, some of my clients rely heavily on their church community because they do a lot of outreach. So thank you. You made me think about that. That's another great reference when you're staying home, who are really all of the people that can come to you in a sense of need.
Susie, anything you would add?
No, I was just going to add faith community, which Jihan just mentioned. And also, you may not have a biological family, but you may have a family of choice, friends, roommates, or whoever, who you're a solo ager and you don't have biological family that's part of your support team.
That takes us right into the next thing that we wanted to talk about and ask is, of those people who are supporting you in your age in place plan, how do you go about, or when is the right time to have those conversations? So whether it's an adult child or your faith group, how do you talk to them about your desire to age in place to build this plan? If it is adult children, that can certainly have some tricky parts to that conversation. So when's the right time, and any suggestions for going about that?
I can definitely kick us off for that one. I think, as you've heard from the other panelists, the earlier you can start, the better. You really are working with an entire support team, and as early as you can to be able to help them understand what your goals are and what your preferences are, the better. That being said, particularly with adult children, yes, it can be a very emotional conversation. Your adult children are adults, of course, but they are still your children. And starting to have these conversations about how you want to age and where you want to be and what is important to you can bring up some of those emotions. And I guess I would like to affirm that that's okay. These conversations are likely going to be multiple in nature, more than one opportunity to have the conversation. And it's often healthy to be able to process through those emotions. Think of your personal goals and how you want to age as the anchor. So that is at the center of all of these conversations, even if they become emotionally charged. And as you've heard this morning, sometimes having a care manager, a third party person to be able to help facilitate those conversations is really, really helpful, because it then allows you to remain in your role in this situation as the parent, and your adult child to remain in their role as the child. Same with your loved ones and your friends and your biological family or family of choice. Having somebody else to be able to guide you through those conversations, help people process what they're feeling and bring you back into focus can be enormously helpful. But the earlier, the better, I would say.
Yeah, I would agree with Debbie. And I know holidays are coming up, and sometimes people feel like that's going to be the perfect time. We'll all be together, and that typically isn't the perfect time. You know, it's nice to enjoy the holiday, but that's perhaps a time to look at your calendars and set a time to have these conversations. People kind of fall into two categories. Some of our clients try to find the time, and the adult children don't want to hear it. They're busy with their lives. They don't want to think about their parents not being there anymore. Or friends may not want to discuss another friend's needs changing. And so sometimes it's the person who needs to listen that's reluctant to join in the conversation. But we certainly also have a lot of adult children or friends of clients who raise a concern, and the client doesn't seem to be ready yet to hear those concerns. Most of us like to have control in our lives. So we can't control the genes that we were born with. We may not be able to control some of the challenges of aging that we experience. And the way to have control, regardless of what happens, is to make those plans and to have people who understand what your wishes are so that they can act on them if you're not able to.
Susie, I was going to say that to piggyback off of what you said, I think that also having the discussion earlier also allows everyone to understand what their roles are going to be, especially if there are more than one child. And we all know the dynamics of some family. There are children that you know are just not going to help. But for those who will, having the discussion up front means that everyone will understand, okay, I'll take care of mom's health needs. Okay, I'll make sure that I take care of the financial piece. Okay, I'll do all of the grocery shopping and the errand running and the medicine pickup. And then if there is just one adult child or just the spouse, at least they'll have an idea of how much they're able to do before they will need to elicit the help of others. But the reason you have that conversation sooner rather than later is if you as the client are no longer able to make those decisions for yourself, we now have to take on what we think you would want. And then in some situations, it may not be what you want at all, but it may be what's best for you or what's the safest for you or what you can afford at the moment. And if you haven't put things in place where we can access some of your other money, I've seen that happen before. Now we're really sort of stuck in a rut because you really can afford more, but we never, got it on paper that we can access here or there. And so having that conversation up front really, really is helpful to all parties involved and gives you that life that you wanted as you've gotten older. Yeah.
And I just wanted to say one more thing, Jihan, because it struck me as you were talking, particularly with adult children, providing them with information about what a village is and the support that the village provides may also be helpful in that conversation. It may help to alleviate any feelings of being overwhelmed or fearful. Sometimes having that extra information about what other resources are available may take some pressure, particularly if there's only one adult child who is trying to digest all this information and then come up with a plan. So I think that may be helpful as well.
And I did see there's a question in the chat about what to do if you think someone could benefit from help, but they aren't willing to have anyone come into the house. And that's a pretty common question that we get. We've been in business 33 years, and I would say the minority of our clients has ever called and said, I'm I'm 87 and I think I'm having some memory loss. When can you get here? I'd love to have you help me out. Usually there's a number of things that go wrong before they or adult child or their attorney or financial planner reaches out to us. So if there's a decision maker in place, whether it's an attorney or a family member, and you're aware of who that person is, reaching out to them and then discussing it with an aging life care manager to get some ideas about how to make that introduction and how to help the person accept help. But then also, if that person is part of a village, reaching out to them to inform them about that as a potential resource to get the ball started in terms of ways that they can remain at home and remain safe.
If I may add one last thing, because I know you all are probably ready to get to the next question, but this is important. When you are looking to have someone age in place, or let me say it differently, you're now searching for services to help with whatever the scenario might be, please keep in mind that a lot of care managers have been through exactly what we're helping you with, which is why we probably have taken the road into this industry and helping others, is that when you've had to help a loved one or move in a loved one, or have had to create an entire care plan for someone who never was able to tell you one thing about what they wanted, we've been there personally. Feel free to always ask a care manager that you've hired, can you share any personal stories with me about how you've had to do this for your own family? It just lets you all understand that we get it maybe professionally, of course, but personally. And that's just really important to know when you're selecting people to help you. Have you ever been through this personally? Do you even have a clue what we're going through? Or are you just checking boxes? Very important to know.
Thank you so much, ladies, and thank you for such an insightful question. And then I just want to remind everybody that we are dedicating the last 30 minutes of the program to questions. So thank you. And then I want to kind of go back to what we were discussing, when's the right time to have this conversation with, adult children. And I just want to say thank you so much for those responses. They were very insightful in how to navigate some of those emotionally charged conversations. And so that brings me, and I want to take a dive into the next question, which is, when should one start putting, a power of attorney, a healthcare power of attorney or a financial power of attorney in place?
Right now. I apologize for jumping in. I feel very passionate about this particular topic because I think it is so important that your voice and what you want and what you don't want and who you want to make decisions for you is put in writing and clear as early as you can. There is certainly no wrong time to do it. But especially over the past year and a half, I think we have all seen how quickly things can change. Mm-hmm. The people that love you the most, being able to have a document that clearly outlines what you do and do not want and what your wishes are and who you are appointing to make those decisions it's such a gift to them so that they do not have to guess or try to assume what you would want, particularly in the middle of a crisis, which is oftentimes when these things happen. And equally as important, it ensures that your voice is heard, whether in that moment you are able to articulate that or not. So I would say the best time to do that is right now, today.
Yeah, I agree, Debbie. And it's interesting, often we have adult children call and they're worried about mom and dad, and they'll say they haven't even done their estate planning, they haven't done powers of attorney. And then I ask the adult children if they have those documents in for themselves, and they'll say, well, but I'm 40, I'm fine. I've got little kids, I don't have anything to worry about. And So, really, everybody, if you own property and you're over the age of 21, you should have a medical and a financial power of attorney in place. They don't have to be exercising that power, but it does need to be in place because we don't know when we're going to have a medical crisis or an accident. And so sometimes I'll say, that's a great opportunity to say to your folks, I just realized I should really have these powers of attorney in place and I don't, and I've found an attorney and he'll sit down and we'll do a family package. We can all get it done at the same time. And the same if you're trying to help a friend. I've just been looking at my power of attorney and realized I need to update it. Do you have your power of attorney in place? Do your family members have copies of it? I've had clients sometimes say they've executed these documents and they're safe. They're in their safe deposit box at the bank. And of course, if they have a crisis, nobody's even going to be able to get into the safe deposit box to get those documents.
And I'd also like to add, on a personal note, I did mine at 26. I think it was important. It's important to do it as early as possible, like we talked about. One of the things you also want to know is who in your family will honor your requests. It was important for me to do it. I have a family of 9 siblings, and all but one would honor my request. They said, we're not going to do that for you. And so the sister that said, I will honor you, is the one who I made my healthcare surrogate. So that's something to think about, is talking with your families when they're having to make that decision for you. Will they make that decision and honor what you've requested in writing?
Great point.
And I would just chime in too, especially if you are aware of there being any conflict in your family, if you have adult children who don't get along with each other, or people in your family who have very different perspectives or see things very differently. It is then helpful once the crisis happens to have it very strictly outlined as to who is in charge of what. It doesn't mean that the crisis, that the conflict disappears, or the crisis for that matter. But if the roles are very clear in the document, then there is always the document to refer back to. And similarly to what Susie said earlier about reviewing the documents. So things change over time, your relationships change. You may have a different perspective on your chosen person as time goes on. So really going back and looking back at the documents and deciding whether the people that you were appointed are still the ones that you would want making those decisions. And also, especially thinking about a healthcare power of attorney, if the decisions that you've outlined in your living will or what have you still align with what your current wishes are, because those are things that can always be changed. But again, you would rather be changing them in a time of calm rather than in a time of crisis.
I don't want to jump to our next question if there's anything else. Still, that's such an important topic. And I will just say, in my former role as the independent living administrator at Ingleside at Rock Creek, this is something that we would do a workshop every single year to say, does it just exactly what some of our care managers and partners on this call said? Does it still reflect what you want to have happen? I mean, throughout each one of our providers, you've heard that same sentence, your voice needs to be heard. It needs to be your autonomous choice of how you want your future directed. And so whether that's engaging a care manager to guide you through this process, or if you're comfortable just jumping right in and saying, I know how to get this done. I know who I want to appoint. But making that happen. So many of our residents would say that's a gift to my children that I already have it sorted out, or to the chosen family who's going to be organizing that for them. So our next question is, what things should you consider when you are looking for a life care manager? I will say that my introduction to this role was in my capacity as an administrator, working with a very organized resident who introduced me to a phenomenal life care manager. And he said to me, she's going to quarterback this plan for me. And I thought, unbelievable, that he is so organized to have a professional in the field who knows all of the resources, who is in this area, knows which hospital he wants to go to, knows his wife's care needs. And he literally used that phrase, quarterbacking. And since that time, I've thought, you know what an incredible resource. So to all of our panelists, what are the things that you should consider, or what questions should you ask when looking for someone to play this role in your life?
Sure. So as I said, the profession is just over 35 years old, was started by social workers, but then very quickly after that, nurses started becoming geriatric care managers. And now as aging life care managers, we might be a nurse, a social worker, a gerontologist, physical therapist, occupational therapist, speech therapist. So we may bring a variety of skills and talents. So if you have a lot of medical needs, you might be looking for an aging life care manager who is a nurse, or where there are nurses on the team. Gerontologists, which we have also on our team, are people who've studied the science of aging. And so if you're looking for someone who can really help guide you towards that healthy aging, the gerontologist care manager may be somebody who really aligns with your needs. And then there's a variety of practices. Some people really like having that one-on-one relationship, and they only want to have a solo practitioner where they're really only dealing with one or maybe two people. And other people appreciate having the strength of a team, knowing that no matter what, there's going to be somebody who knows about your care needs and can step in. And of course, there's also cost could be a factor for you. And if you have long-term care insurance, it may depend. If you have a care coordination benefit, there may be requirements as to the certification of the care manager who would qualify for making use of that benefit.
And I would just add, I agree with everything that Susie has said, and very broadly, the particular person that you're going to be working with has to be somebody that you feel comfortable with. This is somebody who is going to get to know you well over time, who's going to be in your home, who, if you end up in the hospital, he or she will be there. So trust and fit, just like, when you're making a new friend or seeing a therapist or meeting a new doctor, being able to feel comfortable with the particular person is so important.
Mm-hmm.
I completely agree. And I just wanted to also, share with all of you that those of us here on the panel, and of course, those organizations that are not on the panel today, we also work very closely with one another. So our goal in all of the agencies here, and of course, those who are not, is to make sure that you're connected with somebody who is going to meet your needs, because every person has an individual situation. And so I just wanted to share that as well, that we do work very closely together, and we do refer to one another often, and that it really is our priority to make sure that whoever we're working with ends up being connected with the person that's going to best meet their needs.
I often share with folks, you'll sort of get a feel for that person when you speak with them, but interview us as care managers. This is a job still, right? We're still being hired to do a service. So feel free to interview us. And that's why I said earlier, don't hesitate to ask a care manager, have you been through this personally? Do you understand what I'm going through emotionally? Interview us, and also feel comfortable asking for referrals. A lot of our families refer folks to us. So families are sort of our best referral source. But ask to speak with some of the other families that we work with. If you might be on the fence, or you just want to know, someone else's honest opinion, because you are hiring someone to come into your world in a very intimate way, in a very intimate setting. We're asking a lot of questions. We're learning a lot about your family dynamics, and you want to feel that trust and that connection. So don't put that off. It's very, very important, because we're coming into your lives big time, coming into your world.
I did see just one question on the chat about whether a son or a daughter could be a care manager. And of course, we do have families where there's a son or a daughter who's a social worker or a nurse. In fact, we have a client right now who's transitioning to hospice, and it turns out her daughter is a hospice physician. And she's asking us to help with so many things, because even though this is what she does professionally, this is her mom. And she realizes these are challenges to her where she would prefer to be the daughter rather than the professional providing guidance. So certainly you could rely on an adult child or close friend to provide support, but if you're asking them to play a professional role, then that might create some challenges with that personal relationship, whether it's spouse, adult child, or friend. So just something to be aware of. I can't ever be our client's daughter or granddaughter, but I can provide support to them and allow their biological family to have that relationship with each other.
Susie, I'd just like to echo that. That's a great point that you make for all of us in our various roles in this industry. My first experience with care management was as a young mother in my early 30s, hiring someone to help me with my mother-in-law who had an unexpected stroke. But and most recently, having people support me in my husband's illness. And I really I wanted to be a partner and a wife as opposed to his caregiver, which just changes the relationship so much and puts so many strains on the family member, where it's great to have a professional who can bridge that gap so that I can be a wife, or I could be a daughter to my mom. Because I particularly in the end stages of life, you don't want to give that up. I really think that's a very important point to make.
Thank you so much. So that would lead us into the next question, because I'm going to ask the same thing about selecting a caregiving agency. Again, they provide sometimes very intimate services for us. They come into our home. We have to be able to trust them. It's best if we're able to connect with them. Should you consider when selecting a caregiving agency?
Thanks, Angelique. I'll take the lead on that one, and I'm sure we can all have some input in there. But one of the first things you might want to do when you're thinking about selecting a caregiver agency is to ask your village. There are companies that they're familiar with that work, in your area. So ask them if they have any recommendations. Your village leaders. And for me, again, it's like any other business person that you're hiring. It's important that you do your due diligence and do your comparisons. You should call at least 2 agencies and maybe 3. Many agencies have different specialties. Some agencies are great for live-in help, and others are better for not live in. So find out how long they've been in business. Smithlife Home Care has been in business for 22 years. You want to make sure that you're engaged with a reputable company that is licensed. It's been in business a while. It's accredited by the Better Business Bureau. And that pays the taxes of the caregiver that you hire. All of these are important considerations as you age in place. And I know that they were all important questions for me to ask as I engaged caregivers for first my mother, and then my father, and then my husband. So that's just for starters. Allyson, you might want to add some comments there.
Yeah, thanks, Kathleen. I think what you said was great. Yeah, asking for recommendations, checking their reviews. When you call the agency, you want to find out about their staff qualifications. What type of training do they receive? Are they licensed? You also want to ask about the availability of their caregivers. If they have a caregiver and that caregiver gets sick or needs to go on vacation, will they be able to replace that caregiver with a different person? Or do you just not have a replacement until your caregiver returns? That's important to know. And then also just be mindful of your budget. You want to find out what their rates are, but be mindful of your budget. What can you afford? Rebecca, did you want to add anything else? You're on mute.
Hi there, sorry about that. Yeah, I just wanted to add too, when you make the phone call, so when you make a phone call to the companies, right, you want to, that initial conversation is going to be very important, whether you meet with them in person or on the phone. So you want to ask questions like, and I know a couple of people have brought this up, having a caregiver come in your home is very intimate, personal, especially if they're going to be there, several days a week, several hours. So you really want to know that you can trust this person in your house and this person's going to support you or your loved one. So asking questions around, like asking like, what is, like, how do they go about matching a caregiver? What are some of the things that are going to be done in order to place a caregiver that's going to be a good fit for your loved one, right? You really want to, look at a company that's going to listen to your needs, understand your needs, and then go from there and placing a good fit. I know it's been brought up about the caregiver screening and vetting process. What does the company do when they're bringing caregivers on? Do they do it, and you want to ask about that. Are they certified? Are they doing background checks? I mean, again, just to, reiterate what other people said, you want to work with a credible company. Another thing that I find a lot of people ask is, and it's really important, is once a caregiver is placed, how's that ongoing communication look like? I mean, if you have the caregiver there, but who else is, who from the company is going to be your point person and have that ongoing communication? Sometimes you need to make schedule changes, a concern comes up, you have some questions. You want to know that there's that ongoing communication throughout. So, and again, it really is a personal choice. So, I think, comparing, talking to more than one company, and definitely asking as many questions. We're here to help you, get a caregiver that's gonna, support you in your home.
Those are great points, Rebecca. And I think one of the first questions you always have to ask is, when do you want the caregiver? How many days a week, how many hours per day, and what kind of skills do they need to have beyond being a certified nursing assistant? Do you need somebody who's a driver who can take you to that doctor's appointment or run errands for you? You need somebody who's tech savvy, who can help you order groceries online. And so all of the agencies that are here on this call and that we work with are very reputable, but at any moment in time, family and nursing care might not have a driver that can go to that location in those hours, but Smithlife might. And so sometimes it's the qualifications you're looking for that will drive you to one agency or another. And I think that the agencies, I know the agencies that we work with regularly, if they really don't have that fit for that situation, whatever it may be, they'll tell us, and they know we'll come back and look for another caregiver for another situation. We're not just going to try and force that round peg into the square hole.
Susie, that's a great point, and it lines up with the next question I was going to ask, which is how to determine the amount of hours that you would need. And so that's a really important question. I know that in my former role, I was working with families, and I would give kind of a ballpark idea of, say, you might need support in these ways. And then one of the things we would talk about is if you need support in the morning for these activities of daily living, it's possible you need support in the evening too, then, for those same activities of daily living. So maybe our care managers can address that. How do you determine how many hours you need and what that support looks like?
It's really through our discovery phase, just trying to understand really the needs of the client. And oftentimes it is talking to their loved one. You really find out when someone feels inconvenienced or unable to sort of handle their own daily affairs because they're spending so much time in the morning or afternoon helping their loved one. But that's typically how we do. We either observe it for ourselves, or we simply ask a lot of questions to get us to be very clear about what someone needs. And then we also work closely with the home care agencies that who are experts in this field, and they'll even help us determine how they should place their caregivers in there to ensure that which services are needed or are handled. Because for some people it's not morning and evening. For some people it might just be the afternoon because their loved ones are there. They're able to get them up, able to get them fed, able to get them dressed, but they're not there in the middle of the day because this is their time to maybe do yoga or go to the grocery store or go do something fulfilling for themselves. And so maybe it's really just the afternoon. Sometimes for some of my clients, it's really just overnight because their loved one just wants to get some sleep. But this person may be at risk for wandering or a fall in the middle of the night. And so sometimes it can be overnight, but it really is through our discovery, asking a lot of questions and in some cases observing. Hope I answered that.
That's great. Kathleen and Rebecca, can you share what assessment process occurs, when a family's saying I need a caregiver or an adult child is saying I need a caregiver for my parent? What assessment occurs?
Sure. In our organization, well, there's various stages of assessing caregiver need. For me, my first step towards hiring a caregiver was joining a village and knowing that village could help provide the additional support. Then as the needs grew greater, then usually a family member will call, they'll do an interview over the phone. I think it's important for our audience to know out there that there is a caregiver shortage out there currently, and that it's important to receive consistent and continuous care. And that lends itself these days to look like at least 3 days a week and 5 hours per day is kind of a minimum that most agencies have determined that the marketplace can support for hiring the same caregiver. What the intake process looks like is a phone call with me, usually at 8:30 at night, saying, I need help tomorrow. And that's entirely possible. Once we've determined that we're the right fit and the right agency for that individual, then our RN, a registered nurse, will also come and do an assessment in person and evaluate the care needs of that individual. Our registered nurse will then write a care plan for the caregiver to follow. And it's something that looks like, let's see, can I share a screen here? Catherine, yeah? So, for example, task sheet, the nurse would write a care plan, and that would translate into this task calendar that every family member would receive. So they would know medication reminders on Monday AM, Monday, Tuesday, Wednesday, every day of the week in the AM. Monday would be change the linen day. Wednesday would be take them to their yoga appointment. So part of that assessment translates into a calendar that helps support consistency for the care recipient, and so that the family member is also engaged in helping to provide this document. There's also, let's see, let me show the other one where, whoops, get to know me. We want this to be a companion that will help combat social isolation and that will provide the wife or the spouse of the care recipient with a needed break. But we need to have engagement and we need to know something about this person. So, you know, you would write Joe's name here and, you know, that he's a restaurateur and he loves to watch Western movies and he's from New Jersey, and all of the things that make that caregiver, care recipient feel cared about by the caregiver, which in our company is a certified nursing assistant. You know, favorite comfort items for my husband would be a cigar and an easy chair outside, of course. That's just a simple example of some of the many questions and the follow-up that goes into the intake as well as the engagement part of it. And I don't want to take up all the time. Rebecca, you want to answer some more questions, or?
I was just going to add to the, you know, and as, you know, I was just pointed out that it's, you know, each person's needs and the amount of hours are different, right? It's you know, so when you make that initial phone call and you have that conversation, the nurse assessment, learning more about, you know, what the person's needs are, and then from there you can, you know, decide on how many hours are needed. Also need to know that it can change, right? So you might start off with needing maybe only 4 hours or 5 hours, and as your needs change, you need more. And then the company's going to work with you and the caregiver to, you know, to add those more on. So it's individualized and it's through questioning and the nurse assessment and discussion on what your needs are in terms of what are the best hours. But, you know, sometimes, you know, I'll get someone calling and they're overwhelmed and not sure what they need. And we start off with more and then scale back, or they start off with less and add more. And so, you know, I guess what I'm trying to say is that you don't, you know, you can get an idea of what's needed, but you don't always have to, you know, we know that it's flexible and it's going to change. And so, you know, and companies will work with you in terms of making sure that you get the right amount of hours needed, and that you have, you know, and that you have the good caregiver working with you for that.
Thank you, Rebecca. I also wanted to mention the difference between a certified nursing assistant and skilled care. For example, my husband had a catheter, and a certified nursing assistant can empty the catheter bag, but skilled nursing must be employed to change the actual catheter or for wound care. They're two very distinct categories as far as skilled nursing and home care. There's also a difference between home care and home health. So home health is generally physical therapy, occupational therapy, speech therapy, which is paid for by Medicaid or other types of insurance. A certified nursing assistant, which is non-skilled care, is almost always private pay or long-term care insurance. And I'll stop there because there's lots more to be said, but anybody else can jump right in too.
I think this is a great segue to the next question, because we're talking about, you know, caregiver hours and coming into your home. Could you explain a little bit some of the responsibilities of the caregiver? What are the things that they're going to be doing in home?
Sure. Allyson, you want to take that, or would you like me to? You're on mute, Allyson. Okay, I'll take that. So what are the caregiver responsibilities? You know, to be very direct, the caregiver's responsibilities are different in every single home. There's a basic list of about 50 tasks that we provide each family with as a guideline, as far as bathing, meal preparation, basic, you know, laundry, changing linens, medication reminders. But each family has different different things that they ask of us, because everybody's unique, and we adapt our caregivers to whatever your needs are, as long as they're non-skilled. Generally, we don't do dog walking and dog cleanup, because often our children, the adult children, say, well, I want my mom to have a walk at least half a mile, and I want you to take the dog as well. Well, while the caregiver is doing a poop bag, mom falls down, and then the caregiver nobody's happy with that outcome. So generally speaking, will the caregiver let the dog out in the backyard? Yes. But you should also keep in mind that many of the caregivers are from West Africa. Some of them are afraid of dogs. So that's an important part of the conversation to have during the intake. By the way, I have 3 dogs and 2 cats and a hamster. And in addition to taking care of mom, we'd like you to take care of those. So we might, but it's all part of the conversation. Usually 2 dogs is my limit. But I hope that answers the responsibility question. There's, and I'm happy to put up on the screen if you'd like me to, or we can email it out afterwards, kind of a general overview of what caregiver responsibilities generally are. And that is part of every caregiver's daily routine. While mom or dad is taking a 30-minute snooze during a 5-hour shift, that's when the caregiver should be emptying the dishwasher, getting the meal prep for the next meal, throwing in a load of laundry. And, there's time to make all of that time productive. And it just depends on that family member.
Rebecca, anything you would add to that?
No, I mean, the list of responsibilities, you did a great job explaining all the lists of responsibilities. I think, and then again, the only thing I was just going to add to all that was that, and so like I said, you can start off with, okay, after the discussion, this is what you start off with, a list of, this is what you think, the caregiver is going to need, what you want the caregiver to do. And then that might change over time. And you can also add to it, so there's a lot that the CNA can offer. And with that being said, if over time you want to add more responsibilities on, you can absolutely do that, because we know needs change. So I guess what I'm saying is, as needs change, you can add more responsibilities on. And right now, I hope everyone can see the great list here of caregiver services of what the CNAs provide, anywhere from personal care to support services, to toileting, mobility. And there's a lot here that they can do. And so, I don't know if Alison or Kathleen have anything else they'd like to add.
No, nothing really to add there, except that people should also keep in mind that many of our caregivers, they're trained in kosher, they're trained in hospice care. A lot of families think when they put a family member enter into the hospice program or palliative care, that means they're going to have a caregiver at home to help them. And unfortunately, it does not. It does not. Generally, that means 2 hours of care by hospice a week, which is generally not enough care, especially if the care recipient is bedridden. And all of these decisions and intake are made in conjunction with the care partners, whether that's an aging life care manager, the hospice nurse. We all collaborate to provide the best possible care for the care recipient, and we all talk to each other. I know all of our clients have my personal cell phone number. I can be reached evenings and on weekends. And I think that applies. All of us have a 24/7 number because nothing significant really happens between 9 to 5. It's not in my world.
That's so helpful. And I think, Kathleen, one of the things you said was just articulate to the caregiver manager that you're speaking to, what are the needs that you have? You know, if your parent only needs just some meals and companionship, then that's a different case than, as you mentioned, someone who is bedbound. So the more you can articulate and communicate exactly which needs you have, then the better that fit is going to be of the CNA or home health aide who is placed with you. One of the things that we just wanted to ask as a follow-up as we talk about caregivers and having those in your home, we mentioned very briefly that there are some skilled needs that would not be covered by maybe a CNA or a home health aide. Can we just briefly touch on what that means and kind of what it looks like to bring in another partner in care for those needs?
I can start. You know, with, like I said, so for skilled, you know, just there is a difference between home health and home care. And with home health, so home care, non-skilled, certified nursing assistants providing, supporting with activities of daily living, as we just went through. But with home health companies, they're providing PT, OT, RNs, LPNs to come in to assist with certain, you know, with, like I said, wound care, changing the bag and other situations like that. You know, for example, like what might happen is somebody might be sent home from the hospital. They do need a caregiver to assist with their activities of daily living, but then they also have a wound and they need to have that wound dressed. Some people, it depends on the situation. It could be 3 days a week. It could be 5 days a week. So the CNA is not going to be able to dress the wound, but working with a home health company to do that, to come in, to assist, you know, to help with the wound care. In addition to that, folks who are being discharged from the hospital that might need in-home physical therapy, and that's going to be maybe 3 days a week, depending upon their needs. So again, working, you know, so somebody will come in, provide physical therapy, and then the home care company will come in with the caregiver. But there's certain things the caregiver can do. For example, with a physical therapist, they're always going to give you some exercises you need to do on your own. So the caregiver can assist with that, so that the caregiver can help you with those exercises when the physical therapist isn't there, so that you're continuing to build up your strength. So there's ways that they can work together. I know for some of our caregivers have been asked to be there when the physical therapist comes, because then they can see what the exercises they're doing, and then after that can assist the client with, you know, building up their strength and their muscles and what have you. I don't know if Kathleen, you wanted to add anything else, or Allyson?
No, I think you covered it all, but I will say that just keep in mind that we all work very closely with each other. So if for some reason you come onto a service and you find that additional support is needed, whether it's you have a caregiver, but now you need skilled care, we work very closely together and referral manage to make sure that you get what you need in the home.
And I think Kathleen may have touched on this before, but when you are discharging from the hospital or from rehab, your insurance, likely whether it's Medicare or a secondary insurance, is going to cover that home health. So that therapy or that wound nurse or a nurse to check on an incision and make sure it's healing correctly. And I think that's a great point that Rebecca made in terms of having then your caregiver observing your therapy and then helping you with those exercises. As anyone who's ever been prescribed physical therapy knows, if you just do it for the 2 or 3 hours a week that the therapist is there, you're not going to make really great progress. So engaging that home caregiver in doing those exercises every day is what's really going to help you regain the strength that you're hoping to.
Well, if there's nothing left to add, I want to change directions a little bit, and I want to talk about, you know, the large role that socialization and engagement plays in emotional well-being. And as we talk about aging in place at home safely, I would love for us to discuss like what interventions have been put in place to keep, folks at home connected. I know, Catherine, I didn't know if you wanted to talk about some of the things at the village. I know they have a healthy, robust engagement program. I didn't know if you wanted to have some time to discuss some of those programs.
Yeah, sure. I can briefly just mention, we try to have a series of lectures about topics that might be of interest, not just things like this where it's very practical, but also about art, science, literature. And also we create affinity groups, like where people can come together to discuss their interests. I know a lot of other villages likewise have similar groups that also might like play bridge or things like that. It's a way to make sure you have that social contact. Also, we have events like ice cream socials and stuff. COVID's made this a little here, it's mostly on Zoom now, but still it's there. Yeah, I'll leave it to the rest.
I just want to, I'm Linda Kaplan. I'm just going to add, we also have exercise programs. We provide one-on-one social interactions with people. Even during the pandemic, we were able to do some of that. So there is a lot more, involved. We have book groups, we have movie groups. We do a lot of those kinds of things. So there's a real focus on social engagement and social interaction.
Yes, that's a good point. In addition,
as well as providing direct services. Sorry.
Yeah, in addition to the group activities, we can set up friendly visitors and such. So someone who can come by and hang and spend time or call and keep tabs like every few weeks, to just so people know that they have that social contact.
Right. And also rides and, pick up for food. I mean, there are all kinds of services. So
yeah, I will just briefly to address one of the questions in the chat since it's relevant, just saying, well, actually, I'll wait till the Q&A.
I think in terms of social engagement and isolation, I think that was one thing that was tested for all of us during the pandemic. You didn't have to be older to feel isolated at home and all of your usual routines interrupted. So certainly for some people, it's high-tech connection through a FaceTime or a video call. For some people, it's good old-fashioned telephone calls to stay connected. Again, streaming favorite TV programs or movies, again, if you have that capacity, or rereading favorite books. But I think all of us realized how important that social connection is and looked for new ways to try to create them despite the pandemic, whether it was meeting people outdoors or good old-fashioned letters, sending them back and forth. I think we all tried to be as creative as possible to stay connected with friends or family during the pandemic, even if we couldn't see each other face to face. And I know for a lot of families, as they're planning in the future, if I needed to be isolated again, what are some things that I could have proactively in place? I know one assisted living is building into every room a TV that comes with the apartment that you can video call with any device. So you can call somebody whether they have an Android phone or a Apple iPhone or Skype on a computer. You just push their name, and as long as they have video capacity of any kind, every call can be a video call if you would like it. So I think there's been a lot of technology that's tried to help bridge that gap when we can't have eyes on each other.
A lot of the community centers are certainly transitioned their programming to virtual during the pandemic, and I suspect will still be available in some sort of a hybrid format. So I think now more than ever, there are certainly many virtual options for interacting, if that makes sense for you as an individual.
Yeah, I think we all became much more invested in artificial intelligence products. I I know that I used Alexa for my husband and his nursing home and assisted living facility. My Alexa could talk to his Alexa, and it's just a fabulous tool. And many villages do, workshops and seminars to teach people out there just how to get the most out of your artificial intelligence product. And it's a great product for people with dementia because, my husband could ask Alexa, what time is it? 19 times, and Alexa never got annoyed with him. Unlike me.
So thank you. Thank you so much. Those are great responses. And now we're connected in person and virtually, which leads me to my final question. And then I'll turn it over for questions from our viewers and back to Catherine, which is, how would an aging life care manager or someone in private duty provide an individual and their family support when it is no longer safe to age in place?
I'm happy to start that off. We
Thank you.
certainly help families age in place, as I think Jihan said, wherever home is, that's where they want to age in place. But sometimes that isn't sustainable because their physical needs have changed, or the setting itself, it's an older home that needs more repairs than can be done realistically, or there start to be other environmental things, mold and other issues that just make it an unsafe place for them to live. And so then as aging life care managers, again, we don't have a financial relationship with any resource. So we're just looking at what your needs are. We're familiar with what the different options are. So we can match you with a community or a resource that's going to meet your needs when being at home isn't an option, whether it's physically unsustainable or financially unsustainable, or both. I often say to people, if you are going out to buy a new car and you go to a Ford dealership, they will find a Ford that works for you. They won't ever say to you, Benita, I think you'd love a Subaru. I'd love to see you go next door and talk to the Subaru dealership. They're going to help you find, that brand that will work for you. And it's the same way if you walk into a Sunrise or a Brightview. They're good communities, but their job is to sell you on that product. And the aging life care manager can really help you understand the full array of products and then figure out which one is the right resource for you, whether it's the financial piece, the physical piece, finding your peeps, as I say, people you'll enjoy, continuing to age well, putting all of that together for you and helping you understand what the options are.
Sometimes that can, take some time. These are major life changes, and sometimes it can take some time to really, for the care manager to really work with the family and the total care team to eventually get to what is the best place to meet that person's needs. I also, as Susie, as you were talking, one of the things that I know as care managers, we talk with our clients about as well is the difference between surviving and thriving. And sometimes, many times I would say that fear of change, that grief over a season or a chapter that is closing, and ambivalence and fear about the next one that is opening can be really challenging. And so helping someone really take a look at where in the community would you thrive? Thriving meaning that you would be able to live your best life. You would be able to do as many things as you're able to do and receive the support that you need in order to do that in a way that's going to make sense for a variety of factors that are going on in your life. And just, also reflecting that these are not easy decisions. Susie, I think you had said you don't have a lot of people saying, hey, here, I'm here and I have these needs and I need you to get me into a nursing home or assisted living. it is difficult. It is very, very challenging. And that's one of the benefits of having some of the services that you're hearing about today to help navigate through that, especially when, it takes a little bit of time to process through all of those emotions and really make, what the best decision would be.
Thanks, Debbie. That's a great point. And just additionally for our audience out there, if your family member, my family members who have gone on to independent living, assisted living, and nursing homes, my company, Rebecca's company, almost all home care agencies will help provide, they'll bridge the gap and provide care and independent living. We have many families that hire us in the hospital because everyone's resources are stretched these days. So if your loved one is in a rehab facility, independent living, nursing home, wherever they are calling home temporarily or permanently, we can have a caregiver there to provide assistance and sort of help keep them comfortable wherever they are.
And I just wanted to quickly add, tying back to our initial conversation about aging in place. Even if your long-term goal is to age in place in your current home, it's also kind of never too early to start thinking about what community might be the right fit for you should you need it, because it is really a long process. It's a lot of emotional jumps to make. And sometimes when that moment happens, that, the moment of, oh, I'm not going to be able to be safe at home anymore, is in a crisis period again. So following a hospitalization or a rehab stay. And so if you already have some places in mind that feel right to you, it can be somewhat easier to make those decisions in the moment if and when the moment does come. If you already have an inkling of which communities might feel better for you than others. A backup plan. Plan B or C or D.
I was going to say that one of the hardest parts about my job is having to go into someone's home and say this now is no longer the safest option for you. And so it's best to start looking around your home right now. Your stairs, your rugs, your shower, just entry into your home, be it the front door or the garage, when you walk out into your backyard, or there's steps going down into maybe a slippery sidewalk. I can think of a few things, but start looking now just around your home. Would this be an ideal place if you can no longer walk up and down the stairs? If laundry needed to be done, can you still do it? Or would you have to hire someone just to do your laundry? Look at the things that are on your floors. I tell people, just like we talk about getting your affairs in order, start looking around your home to determine if this is where you can be. Should something major happen with your health, or there be a decline or an injury. So we're all about safety first. And I've had to tell some families, I know that may be a shortcut for you, but based on my oath, I have to do what's best for your loved one. And this is just not the safest place. Hard to have to tell people that sometimes, but you can start now, just taking a look around.
That I was going to add to, we all do in my experience, we all do such a great job of planning our careers and planning our families and planning. We do. And then when you think about as you age and what that looks like, you want to put that same amount of effort into that as well. And planning for your, if you want to age in place, you want to move to a community, you want to get a caregiver that you want to think about, I know for me, and I can just say, 4 years ago, before I started working for family and nursing care, a lot of these things weren't in my mind on how I wanted, what I want to do when I got older. And as soon as I started working for family and nursing care, I've had a completely different perspective and been talking to my parents about that and helping them get a plan together. So because everybody that, you know, I speak to, we all do such a good job at planning so many things in our lives. So planning, how do you want to age in place, and, you know, who you want as a caregiver, where you want to live, you know, talking to your children. I mean, it's really important, you know, so.
Catherine, I think that takes us into questions. If you would like to open it up, I know we just have a few more minutes.
Yeah, sorry. So I think I just want to check. Did somebody say, I don't think so, but maybe I missed something, what the typical hourly rates are for, like, that someone can expect to pay for a home health aide or RN, you know, whether agency or independently?
Sure. For Smithlife Home Care, the rate in Montgomery County for Maryland is $27.95 an hour. It doesn't go up, it doesn't go down. And for Washington, D.C., for Smithlife Home Care, it's $28.95. Same, doesn't go up, doesn't go down on weekends or evenings. It's a flat rate.
Oh, and I guess also care managers. Sorry, not just it says care managers, so but those as well. How much they usually charge, types of services and amounts.
I was going to say that care managers, and I know Susie will jump in, that range is so broad because you are dealing with a very small sort of organization with maybe 1 or 2 people, up to, like Susie said, up to, I believe you have 15 people in your practice. Mm-hmm. And the reason why the range is so broad is that you're not just paying for the care management services, but there's so many other services that sort of come with it. So I always tell people I've seen a span of $50 to $250 per hour. And I know that that's broad, but it honestly depends on who you hire and really the services that you're looking at. So while that's broad, and I don't know if you all can narrow it down for me, I've seen anywhere from $50 to $250 an hour for care management.
Yeah, the prices vary, you know, across the country depending on the market. Members of the Aging Life Care Association, there are over 2,000 of us across the country and over 200 just in this mid-Atlantic region. And we check our pricing with each other from time to time, but right now our care managers bill at the rate of $170 an hour for care management. So that's visits and talking to your doctors, communicating with family. And if you just want a consultation with me or a member of the leadership team, that's $185 an hour. And then we do bill for travel because we pay all of our care managers to travel to you. And for us, that rate is $75 an hour. As a team, we travel 110,000 miles a year, and I pay for all of that gas money. So that's why we do charge for that travel time, because our care managers are coming to you. You're in the hospital or at home or wherever you may be. And again, that could be covered by your long-term care insurance up to your annual maximum benefit. And otherwise it can go into that same bucket as a tax-deductible medical expense with your home care expense, Kathleen, and family and nursing care, those expenses.
Great. And I think we covered the caregiver responsibilities to an extent. We had, I'm not sure this person's on anymore, but you know, it will be recorded. Someone said that their brother was hospitalized and that this person is the brother's healthcare proxy. They realized they didn't know what decisions are right. For example, do more testing, but that means then more days in the hospital, which is unpleasant and disorienting. What type of help would be best in this situation to provide this person who's trying to figure out the right thing to do for their brother?
To me, it sounds like that's a situation where a care manager could be really helpful, not in telling you what is the right decision, but in being that objective person who can help you to weigh the pros and cons.
I agree. I think having somebody to help you digest and weigh the pros and cons with all the information that you are receiving from physicians and different specialists in the hospital is very helpful. That is in a very emotionally charged situation, and often a crisis in the hospital. And also speaks to, I think, my final plug for advanced directives, which is, having as much as you can, your preferences and values and goals laid out in a living will or advanced directive document. You're not going to be able to put everything in there. Of course, it's not reasonable, but as much as possible to be able to do that as well.
Yeah, exactly. And really understanding what the goals were of care for that person. And a lot of those documents talk about what they want at end of life. So it's really asking that question, are we at end of life? Because maybe it's a medical crisis, but it's not an end of life crisis. So I agree with Alison with everything else that you've also said, and Debbie.
When I read this crisis from Elaine, I thought to myself, as care managers, not only do we come in without the emotion, so we can sort of come right into the situation and you can kind of hit us with everything. We understand the jargon a lot more, and we can translate it so that our families can understand what was just told to them in really a heightened and emotional situation. So if nothing else, I think care managers are good for that. It's not that we're emotionless. Remember, we've told you we've been through this before. But we're able to come from it from a different perspective. And it's just a scary time right now to be sick. It's a scary time to be in the hospital. It's a scary time to be told that your loved one needs X, Y, and Z, and you're the person that has to make the decision. Okay, like, oh, that's scary. And we get that. So we try and come in as calm as we can, as knowledgeable as we can. And we really want to help you make the best decision. But it really has a lot to do with that translation of what you were just told and what it means. Once we know what it means, it's a little less scary because now we know what we're dealing with. And so I wish, I don't know if Elaine is still on the call, but I'm hoping that has answered your question, and that if he's still there, that you're able to get the help that you need to help make those decisions, because I know it's tough right now for you.
Hey, two more quick questions. And again, sorry, just so much great information. It's hard to get through it all. One person was asking about home sharing. This is submitted to our survey, asking, so I live in a 1-story house with 3 bedrooms and 2 baths. There must be people out there willing to live in my house rent-free in exchange for them giving me some help with tasks of daily living, as long as they don't have dementia or not confined to a bed. I did want to note, we actually had a panel. I know this because we had a presentation recently. There's a group in Montgomery. If you live in Montgomery County, there is something called the Housing Initiative.
Partnership.
Yes, partnership. Housing Initiative Partnership. And they have a whole program where they will match you. So they will do the vetting part and provide kind of a mediating party to help find you someone who's looking for such a situation like that, or maybe paying some nominal rent. So Montgomery County, I can send that information out, that contact to along with the recording. So that's one option, and they might know of similar programs outside Montgomery County. But so there are people who do that as one option. Did any of the panelists have an answer to? Okay, well, one last question real quick. I did want to clarify, someone asked about villages versus professional care, and it's mainly like villages are less intensive. It's more kind of like imagining what your neighbor would do for you. Things like changing a light bulb, light repairs, like bringing your trash bins to the curb, like they might do themselves, and, rides with people with a certain level of mobility. But things like administering medication, preparing someone's daily meals, doing someone's laundry, things like that are, a professional person should be doing.
Villages. Villages are totally volunteer based.
Yes, that
So the
exactly.
services are all done by volunteers. It's not done on a professional basis. It's neighbors helping neighbors. I just want to be clear. So
Exactly.
it's
Yeah.
a
So
very
it's,
different function. Yeah.
yeah.
And
So
I know
that's,
you were.
you know,
Thank you.
yeah. So that's the kind of to think about that, you know, you don't, that's unfair to, you know, someone volunteering their time, you know, they only have so much time. So sometimes frequency too, like they can give a occasional respite visit, but not like every day for certain hours, you know, then you need a professional with you. So things like that. So thank you everyone so much for joining us. And I just want to say, and thank you to the panelists as well. We really appreciate you sharing your time and expertise. I especially want to thank Angelique and Kirsten too for bringing together this panel of experts. We couldn't have done this without you. We hope everyone found this event useful. I will be emailing out the recording and the contact information for all of our panelists to everyone who registered for our program. So if you are on here and you did not register, and you're outside the Chevy Chase at Home community, please, you might want to drop your email quickly in the chat so that I can make sure I have that. And I do want to note we have our next one in the series is next month, Friday, December 3rd, also at 1 p.m. And that's going to focus more on the financial and more specifics about financial and legal planning for future healthcare needs, whether you're planning on aging in place like we discussed today, or if you think you might have to move, you might be moving to independent living or assisted living at some point. So things like long-term care insurance, financial planning, more nitty-gritty about advanced directives and other things like that. So kind of builds on today's session and then into additions into future sessions. And if you want it, I will be sending out a link to register for that if you're interested, or also I'll drop that in the chat as well real quick.
Catherine, thank you.
Yeah, so thank you everyone and have a great day.
Thank you for having us, everyone. Have a fantastic weekend.
Thank you all. Take care.
Thank you.
Yeah, have a great weekend.
Thank you, Angelique. Great job. And Kirsten. Bye, Betty.